God, it's not gonna be.
You.
You're the man.
Please, I gotta remember how to do it.
Michelle will watch it too.
Roll call.
Yep.
I'm here.
Mike? I'm here. Not here. Jason must be here.
Jason's here somewhere.
Any additions to the agenda?
Yeah, Jason wants to add, where do you want it? He wants to add the chief, he got this thing late yesterday afternoon, the chief information or officer, where do you want to add this to the agenda? Or,
I would, yes, just to discuss it, I would like, are we to that point? Sorry.
we are.
I make a motion to approve the agenda with the addition of discuss the OCIO, via the OCIO program.
I'll support that.
All those in favor, say aye.
Aye.
All those opposed? Motion carried. July 13th minutes. Anybody look those over? Any corrections or additions?
I didn't see anything that stuck out at me.
Motion to approve.
I'll support that.
All those in favor?
Aye.
All those opposed? Motion carried. August schedule.
Looks like the 10th and the 24th.
Yeah, and then the 10th in the afternoon, we'll have the drainage over in Harris Civic Center. Do you have your calendar?
So we'll have the 10th and the 24th. Do you need a motion for that?
I will not be available on the 10th, just remember.
Okay.
And I won't be here on the 24th. But the girls can be.
I'll make that a motion.
Support. All those in favor?
Aye.
All those opposed?
The one in Harris, what time is that?
1:30 and 3.
1:30
And 3.
I'll stay on that. Those did not get a meeting.
You said 1:30.
1:30 and 3 o'clock. 1:30 is a joint District 3, and then 3 o'clock is 64 and 65. All of it there.
Okay.
Yeah, and I already got that.
Simple already.
It's available.
Motion carried. Yes, discuss a food truck hold.
The board approved it earlier, but with the circumstances, they cannot get the 2024 truck. 22, yeah. Now they're going to for a the 2023 truck. They couldn't.
We didn't get any paper on that.
Yeah, it's in there. Keep going. Yeah, keep going. The price page.
Is there any difference?
Yeah, there's difference in price.
Show on the back there.
What we approved, what the board approved in May was for $114.179, and now this one is $126,271.
But they want a full year.
Yeah, we did.
Do we need to go back and?
It's the same truck, just the circumstances, they couldn't get what the board, what we had applied for.
I guess my question is, do we need to go back and see if we can do cheaper somewhere else? I know we approved that, but it is.
Well, listen,
Yeah, since we had a second truck bid, but then, thousands, not tens of thousands, if I recall.
Whatever you guys think, it's just a thought.
You wanted to stay with this one brand, right? One was,
But didn't you have the same bid for the same truck, and two different people?
was it one out of Sioux Falls, one out of Sioux City?
I think so.
I have it right here. This is 114, 179. Bristol truck equipment, that was 114,516.
And that's the same truck.
What are your thoughts, Reese?
Let's see.
I guess for a company to say, oh, we can't give you what we bid you, and then to go with something different, the other companies, I guess, reasonably should have a shot at it.
Western Star. Western Star. Western Star, I guess that's.
I know we're going up a year, but I'll be honest with you, to me, that means something.
I don't feel a lot of vehicles, I know Jed companies either that we might be seeing vehicles.
That's like, ask these people.
Buy it now, or to accept this at the high point, but some concern with this.
So we're looking at, from this one, 23 or 22?
3,
23 of them.
And what was the other?
2. But I'd ask Mike to call this other one and see what.
Maybe we could get a 22 yet from that other company, I don't know.
Well, it's something that it cannot be built because there's no for they cannot build what they quoted, and that's why we have to go to the 23.
That's Mike to, the other one.
I would too.
Contractor, we got another contract meeting, Barry?
Nothing.
Oh, contracts don't mean squat.
Don't even get me started, let's stop.
Sorry.
Stop that conversation.
I'd like to agree with you, because I think we have probably have the same opinion.
Well, I just don't understand how they prevented the growth.
Well, you would like Mike to get more quotes than it is.
Yeah, people are consistent, or whichever.
If it's the same truck,
Yeah.
or if we could get the same truck that we,
Yeah.
from that, maybe they got this, you know.
Maybe they have one in.
Mike's not available today. Yeah, I'm not prepared to approve this without
I'm not even
hearing a little bit more from him, or maybe researching the other options. Guessing he presented this because he kind
Hey,
of big
is
in
Mike
it.
available at all?
Of a year, that's what it's.
Okay, all right, they're just discussing the truck and they
See
know,
what other people say.
if you should go get other bids or, you know, if you did anything or.
Well, it said right on the top, purchase agreement.
I didn't read all the small stuff on the back.
I didn't either.
But we did purchase.
Sarah, Mike's on vacation, Sarah just said that if you don't order it soon, then we won't get the truck. Next year.
We ordered the last one, too, and they didn't give us that truck. Appreciate them.
I know.
Let's get a little information as far as I'm concerned.
Okay, can do.
All right.
Okay.
Discuss EMS as an essential service. Was that you, Sandy?
Yeah. So, on June 9th, Governor Reynolds, signed a law that indicates that it's up to on the county level to pass. We'll have to have it as voted on, whether or not to use some funding to, use that for, essential services for EMS. So, Rochelle was really nice to print all this nice information out for us. Personally, I think it's actually a groundbreaking, idea. EMS has kind of been the underdog for a long time. You know, you have to have fire, you have to have police protection. And now by doing this and voting on this, it would actually, be able to, you know, give the public some insurance that they will have health or they'll have an EMS service, providing, that there's still people around to do it. So I think what our board has to do is decide whether or not we are willing to go forward doing this. There's quite a few little hurdles that we have to jump, isn't it, Rochelle? Basically, we need to set up an advisory group to find out what actually our needs are, or what the cost of our needs are going to be. Right now, we get a budget. I'm only assuming that if we go forward with this tax money would be added to my budget, I'm hoping for. I know, so,
My understanding would be that it would replace it, but
oh,
allow
okay,
growth beyond what current restrictions would allow.
okay. Because we can't really use a lot of our, I mean, we have reimbursement already from our ambulance, but, most of our reimbursement, or most of our people that live in our county are Medicare and Medicaid. Like, we can bill out as simple, like a Medicaid bill for $633, we're looking at a check for $116.91. The rest of it's written off. I mean, that's the hard, you know, so your reimbursements aren't really there either. So the two downfalls that I see, I mean, there's an advantage to this. An advantage is basically we ensure, I mean, at least the residents of our county get the minimum capability of having an ambulance service. And the disadvantage is, okay, it's gonna be the burden on the taxpayers. You know. So it looks like there's two different options. You know, one is that income tax surtax, and that you can go from 1% to 20%. And then the other one is, taxing for property and taxes of that, and that's, I think, 75 cents per thousand, that's actually going to pay for. Yeah, I think I talked to Mike before, and we need to really have a 5-year plan. We need to figure out what it's going to cost to keep this service going. And I really don't believe that the residents of Osceola County realize how desperate we're getting, you know, to the point where you might call 911, but to get where that ambulance is going to be coming from is a real, you know, that's a real situation right now. We have to figure something out. We have to. I think that the board should really look at that as far as trying to agree upon that we would vote for that.
I think, it's kind of a no-brainer. Fire has been taxed forever. It's done a little differently, it's through the townships, but that's always been an essential service.
We have to supply that, but nothing says we have to supply it.
That's right. And if you look at the call volume, I mean, Sibley probably has 60 calls a year, and the ambulance has what?
We do, well, in 2019, we did 604 calls, ambulance calls. Right now, we're at 310 or something like that for the year. So we're you know, we're out there a lot, and most of it's done by volunteers out of the very goodness of their heart, you know. Even through the whole pandemic, they were out there, you know, and there was no safety net.
So are you thinking these volunteers will turn into employees?
I was kind of hoping that we could somehow, you know, even if we could get them as part-time employees, or, I'm not really for sure. I know we're gonna have to hire somebody. We're gonna have to if this goes through, we are going to have to somehow guarantee the residents of Osceola County that every hour of every day, anytime that they call 911, that there will be a service, there will be our service that will take care of them. Right now, we pretty much do that right now, but we do that on volunteers.
Do you think, Sandy, that by paying or calling it a paid position will get more people?
I think that.
Personally, I think not.
Okay.
But
see, I'm thinking EMS is a career. I mean, you can take that course, you can pass the course, and there's jobs out there, you know, they're always hiring. So EMS is a career, and actually a stepping stone to, you know, if you want to go on to nursing, want to go on for NP or stepping stone. I really believe that it can turn into
Well, just to add to that, any one of us in the county, any of us EMTs, we could go, Sheldon's always looking for help, they pay. Worthington's constantly calling, wanting people to come work up there at the hospital, they pay very well. I mean, Dickinson County, the ambulance is out of the hospital, they pay very well. So, I mean, it is really a career, and anybody that didn't have roots and a job here, they could easily go get a job at one of these ambulance services if they were so inclined, but
as far
we're
as,
kind of a dinosaur.
as a part-time, say, in the towns of Malvern, Ocean, and May City, they, there's a lot of people that wanna be at home, but, need a part-time job, or need a job that, maybe supplements their income or something, and I think that would, to me, it might be a benefit.
What did you find out the other day when you met with the hospital down there?
Right.
How did that come out?
Well, we're gonna do an open house on September 11th down here in Sibley. And this is trying to recruit people for our whole county. It's not just for Sibley, it's for everybody. And we're trying to, the hospital has agreed to help us do some advertising and some PR. I'm not gonna go any farther and say that they would help, like, pay for a person to take up that course, but they would,
And then Kevin Miller, NCC, was there also, and he also wants to come and talk to you guys, but we're trying to come up with some sort of plan to get people to become EMTs. He wants to have a class in Osceola County, which will help, but still we have to get people to want to do it. So that was basically what the conversation was with Ben and Kevin, and so Ben was trying to go around to businesses in the different towns and see if any of them would like sponsor an EMT, because it's what does it cost?
It's close to about $1,800 is by the time you pay for, the class is $1,500, and then they have to pay for the testing, they have to pay for the background checks, they have to pay for some other, just to do the testing side, whether that's practical or whether that's the actual online.
But I was still thinking from $1,800 to $2,000 just talk to us.
Yeah,
We don't.
and the thing of it is that, that's a lot of money. I mean, it's a lot of money for our EMS service to be able to say, okay, go ahead and do that. We have one person right now, she's on her 6th attempt to take that test. And if she doesn't if she fails on that test, she has to take the whole course over again. At the cost, I mean, it's not a free one, then you don't get the second one free, you have to repay for that.
But I'm just saying, the $1,800 to $2,000, that's a minor deal, just talk to us about that.
But our goal is like 20 people, so.
Yeah,
20
because we're trying not only for EMTs, but for first responders too. And as Kevin said, he can join those two classes together. There's a lot of things that are similar to, their studies will be online, but their practical, things, a lot of them are, they can do some of the same things. So we're trying to do that, trying to get the whole, that would.
If you got a minute, wanna hang on, we got a 9 o'clock, we have to, on the agenda.
Oh,
So if
okay.
you wanna maybe slide in between there, if you wanna talk about it some more, or we got to start at 9 o'clock. Sorry, didn't mean to.
No, I know you're doing.
Like I said, I'll do you guys. 9 o'clock, from here, for approved resolution number 2/21/22.
Feel bad.
Pick somebody else, well,
That's the goal.
that's why why we have the input.
I wish we could be here all morning.
How are you guys doing?
Good.
How are you, sir? So I'm Scott Shirley with Career Communications, and here I'm asking for something free, which is kind of fun, but a resolution to support the state of Iowa last year approved funding through Iowa's Empower Rural Iowa Broadband Grant. Big word. And what that allows is companies basically to put fiber in the ground. And you can see from the map, we're looking at rural Ashton as kind of our next project. We serve the community of Ashton. We do not currently serve the rural area. That's done by another provider. But the people in that area, quite honestly, don't have high-speed internet. And we've been successful the last few years getting some Iowa grants. We did rural Rock Rapids, rural Haywood, and rural Akron. And now we're going to try and do rural Ashton. It'll be about a $3.5 million project for Premier. Serve approximately 175 locations, give or take. That's the engineer's estimate. And some of the engineering is done, but with the goal of tackling this for the most part next year.
You talking like a franchise or a designated area that only you can serve, or it's just the effort you're making providing for that area?
Yep, there's a need there. I mean, there's...
I've seen stuff on Facebook, someone who do you use?
You know, so facility as an example, town and rural have fiber everywhere. Well, when you're literally across the road, your neighbor can get 500 meg internet and you can't get anything. That's real. You know, it's not uncommon to get calls weekly from areas we don't serve or they don't have capabilities. So yeah, we're going to try and get the grant. Doesn't mean we'll be successful. In order to really do this project, we'll need about 50% funding from the state to make the numbers work, and that's what we're going to shoot for. It's about 50%. So, you know, 1.8 million is what we're going to do. So, and then part of the application process is getting support, right?
And this isn't going to cost the county anything?
No,
Kind of a little bit.
but it's a big deal if you support it for us, I can tell you that.
That's been an ISAC priority for years, so I decided to make a motion for resolution 2.
I'd support it.
We have a motion and support. All those in favor?
Aye.
Aye.
All those opposed?
Actually, a roll call.
Oh, sorry. Jason?
Aye.
Mike?
Aye.
Leroy?
Aye.
And I vote aye.
Kind of hard sell, wasn't it?
Well, you know, we're all in it together, right? I mean,
Is your intentions to keep expanding?
you know, where we can, our goal is not to conquer Sioux Falls and Sioux City and those.
Well, there's a mountain, so I'm not.
If the state would be kind enough to keep doing grants and it makes sense, you know, we don't want to necessarily go outside of the home base. So like Webb and Dickens are further east, we probably wouldn't expand in that area, but where it makes sense, absolutely.
But Melbourne's pretty close, so Cheekie's pretty close.
We only got so many shekels every year to spend, so.
Hoping you're built.
Well, we should have talked about this before we okay. We need to make a deal.
Do you need the original resolution or a copy or?
No, that's a signature, and we're gonna include it with the application.
Okay.
So,
So you want like the original is what you're thinking?
yeah,
Okay.
yeah.
I'll have Jerry send it and I'll do the original for you. Copy.
And Jerry, did you get my letter?
I did, but I've been busy, I'll be honest, I haven't been able to.
Okay. Okay. I'm gonna give you a copy.
Okay.
And if it's possible, to get it today, or fax it over, just because the application's due tomorrow.
So what do I need to do?
I need your signature on the letter that says,
Give
yes,
it.
a great project.
I I'm not gonna lie to you. When it comes to computers,
I
all that
you
stuff,
know,
I'm
it's all good, it's all good, and it's, you may read that obviously, but it,
I think I did read this part here.
we need certain letters of
Any
support,
certain place?
certain letters of reference, and the state loves paperwork.
There you go.
You're a good man, thank you.
I don't know if I'm a good man or not.
You can find that resolution, then if you need the original of that too, then I'll make a copy if I have it from my record.
Well, appreciate your time, and I feel bad that she left, so that was not.
Was it gone?
I don't know.
Too many out of the hall.
Yeah.
You're about, don't have to call them out, because we got another.
And we'll let you know, obviously, if we get the grant, it'll take a few months.
Remember, we said we want to expand.
Yeah, we're doing our best.
Remember, we like the whole county, you know,
Yeah.
So, it's kind of cool. Last year, we finished up, rural Rock Rapids. Lyon County became the first county in the state to be gate capable. Sioux County, close, we're working on Plymouth, we're trying to get a grant, same grant for rural Lamar. You know, Northwest Iowa's home to us, this is it, so, yes, we hear you.
So, so we appreciate the county.
Yep.
So,
Yeah, cool. Thank you, guys.
Thank you.
Have a good day.
you too. It's not cheap to pay.
It seems like an awful lot to me, but everything's an awful lot. You wanna try to approve the contract for the nonprofits, or you wanna wait?
So that's kind of a quick deal, isn't it?
Yeah, I had, this contract that I got from Sioux County, and he got it from, Story County, and our county attorney reviewed it, and he didn't have any problem with it, so I figured, probably should be in there. Yeah, it's here, it's here, it's present, sign rough. Yeah, right here. So I think I had to send it to RIDE, Family Crisis Center, CAPTA, Elbridge, Regional Housing, Oklahoma County Express, Upper Des Moines. So I was planning on sending it to you.
We just have to approve these.
And then once the original contract comes back from each individual entity, then you'll have to approve it again. But I just want you guys to review it to see if it was okay. Like I said, I had no one look it over and he thought it was good, so.
I'll make a motion to approve it.
Are you making a motion to approve it?
That's the contract we use for nonprofit.
We got a motion and a second, all those in favor?
Aye.
All those opposed? Motion carried. Well, we can slide things in there.
I'll make a motion to appoint that to the Oklahoma County Clerk.
Motion and support, all those in favor?
Aye.
All those opposed? Motion carried.
Staying,
Okay, sorry. This is stuff I'm learning. I don't know, is that certified tax? Lucky state. You try to get that slid in there or not? No? Okay. Well, we got a minute, so. Oh, mine's 9:50. Drug plan application review and resolution of the debt review ordinance. Who's got that? You know?
Yeah, it's kind of neat. I think, do you want me to grab Sharon real quick, though? We're not even working on this.
Whatever you think, yeah. Please, Mary, please.
That's a whole big package in there.
That's why she never ever takes the deals out.
Well, I tried, I'm sorry. Talking to one of these with Agnell, but.
Doctor should know how to check her out.
Yeah. So this is a staple thing, and
city could be flooded out pretty easily.
And steel looked different on that picture than I was thinking it would.
Like,
Kurt Finning's building band steel. The big one kind of blended into the ground.
Going back? Yeah. Okay.
There's no Ed?
No, Ed,
Oh, okay, I thought we were, no.
I'm Ed today, so.
Ed and Jerry?
Where?
And Jerry. Did you recover from the bear? What a turnout. Wow. Yeah, very nice. So you asked me to put together something here for the National Floodplain Insurance Program. So this is informational only. We need to make an application, adopt a resolution of intent, and an ordinance in order to participate in the program. The maps are effective on November 5th, 2021, and we have a year from then to sign up. So, these documents were provided, by the DNR. Jason Kahn is my contact at the DNR. And I think his name is on the letter on the, yeah, he's my contact. If you have any questions, I would suggest that you talk to him as well. These are model, documents, and I had Nolan help me tweak them.
Right.
To fit Ocho County. There were a couple choices on the, ordinance, and the one we chose was the one that would, coordinate with our zoning, because we have zoning. And there may be, a time where we need a board of adjustment, and we already have a board of adjustment with zoning. So this ordinance, complements our zoning ordinance. I went through, it's the maps I provided you, it's the yellow, that is the 100-year floodplain. That's that's the one we're worried about. The pinkish purple is the 500-year. We don't have to worry about that one. We're just worried about the yellow. So I had to go through across the county, section by section, and count all the buildings that were in the floodplain, currently in the floodplain, and all the dwellings. I've given you a couple parcels in Harrison where you can see they're clearly in the floodplain. Not many across the county are in the floodplain currently, except May City is going to be a problem area, the west side of May City. So those people definitely will have to get notified when when this becomes effective and we participate in the program, because currently they probably aren't even getting a building permit to do anything. So we have to definitely make them aware. And then there would be an application that the DNR would have to approve before they did any building. So, like I said, I just provided you with these documents, the application, the resolution of intent, and the ordinance for you to look over. If they're acceptable, we can have Nolan give them the second look at them and make sure they're good to go before we, I don't know, put the ordinance in place, what he probably should have a couple readings.
Have 3 readings,
Yeah.
So,
or you wait second and third, I think.
Right.
so, yeah, so we'll get all that in place before we send it off, and,
So if you do this, Sharon, if somebody wants to build in this 100-year floodplain, they have to apply?
they have to have a permit. There's no ag extensions like our current zoning, ag is exempt, no one is exempt.
And we have not had this before.
Right, this would be new for Ocho County. Yeah.
Is this good or bad?
Well, the bankers like it. Okay, so, I'm just, taking baby steps here, learning as we go. But, from what I understand, 3 years ago, everything was wet. And so if you have this plan in place, And whether you have flood insurance or not, you're eligible for disaster relief.
Oh, okay.
So that's the big thing, I think. Yeah, now, right. And I think 3 years ago, there probably was some people that, were looking for some relief, but if you don't have this in place, then they're not eligible for the federal disaster.
Could this prevent somebody from building something?
Yes, it could, yes. And I think like that Macy's probably doing.
So it's good and bad for both sides of this.
Yeah,
Well, it
yeah.
depends what kind of risk they wanna take, it's informing them of what the risks are if they do want to build there.
Yeah, but I don't know what, we have to, they have to get that approved by the DNR, so I don't know how strict the DNR is, so. Like I said, May City, I love that May City, that's one that got a lot. Most of these are ag buildings that we found out there, maybe a few commercial buildings, but the only homes I really seen were like in May City. Now, there really hasn't been much new construction in May City. I think it's like if you wanted to put up a garage or a storage shed, I think it probably wouldn't be so serious. It's the dwelling. The dwelling, that'll be a problem. But
And the yellow is 100 and the pink is
500, right, you were only worried about the yellow.
Do we have to make a decision?
No, I was going to give you these documents for you to look over and, think on, like I said, November 5th. We have done the maps are expected till November 5th. So if we had all this in place and sent our application off, and then we have a year from November 5th. So I don't know that there's a rush, it's pretty darn dry out there.
You were going, why is there a penalty of this failing to comply with the requirements constituting a misdemeanor? Is that if you're applying for the program and you don't follow the things, or if you decide not to do it?
If we're in the program.
I understand it's an overall penalty if we as a county are in the program, and that is a draft ordinance that came from, correct me if I'm wrong, Sharon, was that an ICAP?
Yeah, DNR.
A DNR, we had a couple different forms that we
Yeah.
used, or a couple different form ordinances, and that's an ordinance that I just basically changed, so it had Osceola County's labels and names on it, and if you guys don't want to have simple misdemeanor penalty in it, you don't want to make it enforceable via simple misdemeanor, I can remove that and change the language on it so that there are no criminal enforcement teeth and just a simple fine. That's an option we have. Like Sharon said, today it's just kind of an informal look here. We haven't even published it. We're not talking about waiving second and third reading, so there's plenty of room for all of you gentlemen to talk about what you do and don't want to see in there, how you do and don't want to modify it, and if you want to take the simple misdemeanor enforcement provision out, just because, I understand sometimes when you pass ordinances, if it's something that's forcing people to do or not do a thing, and then you have penalties on top of it like those, perhaps that could ruffle some feathers. I get that, that's totally your option.
I think we need to participate in the program.
Yeah.
And if someone decides, my farm place is already in the entire 100-year flood, I'm still gonna add on to my house.
Yeah.
But to do that, and then you have a $500 misdemeanor
Yeah.
charge, wait a minute, they've lived there for 80 years already,
Yeah.
why do we need to penalize them? I mean, that's just a concern I have.
My question is, could they, if they can't get a DNR permit, could they even add on to their house if we're in the program?
You have to have a DNR permit, you can add on to your house?
Well, if you're in the floodplain, you have, right, they'll make an application here, but then if it's in the floodplain, the DNR has to sign off on it. So I don't know if the DNR
To me,
can, no.
I support that if it means you qualify then for the program if you meet the DNR requirements. If they wanna do it and void any coverage from the program,
Yes, that's true.
that's what I want left available to situations, I guess.
And then we can talk about figuring out if that is something that will be the complete effect of that, ifs, ands, or buts, or if you want different language in it. I mean, again, that's pretty much just a form, really, that a lot of counties have adopted wholesale. Your call if you want to change it.
And Jason Kahn at the DNR said, if we make any changes to that model ordinance, he would like to look it over before we publish.
Well, it says
line there, amendments, they can be amended, supplement, change, or repeal any time, right? From time to time, I don't know what that means.
If you wanted to, pass that ordinance as is or with modifications, then you want to modify it later, you could modify it via subsequent ordinance. And, usually we talk about the process for passing ordinances, published first, second, third reading. We have some time to consider this, but if you get to a place where you want to act on this, it's flood insurance. It may be dry now, but it could always flood at any time. It can change at short time's notice, So if you guys wanted to pass this and then modify it later, given kind of the exigency, shall we say, of what we're kind of maybe dealing with here, you could make fairly expedient modifications to this ordinance.
Kind of agree with Jason though, that kind of like that.
Yeah, I don't know why we have to kind of like, we make them aware. Of the
Yeah.
consequences.
And
It
I
doesn't
think,
mean anything by collecting the people sometimes.
yeah, you don't do anything with the penalty. And the other thing too, I would say is, if you want it to be enforceable, from a legal point of view, I get that people get a little up in arms when you start saying simple misdemeanor. Those words together, people look at that as, well, I didn't steal from somebody. This isn't a public intox ticket. Why are you doing this to me? If you just want to make it so there's a fine, so there's some teeth in it, but it's not, simple misdemeanor, you're coming to magistrate court upstairs, that maybe changes sort of the tone of it a little bit. It's for you guys to consider.
That'd be my thought, I'd like to proceed, and if it's necessary, but that'd be one concern.
Okay.
Address.
So do we need to just table this for now, or do we need to have a resolution?
I'd say let's table it, give us a little time to look it over.
Yeah, we've got time, I think that's good.
I think that motion,
And motion and support to table this. All those in favor? Aye. All those opposed?
I'm glad it was someone's
Motion carried. We're just gonna sit on this a little bit and think about it.
Thank you, guys.
Yeah, thank you.
Next time we get off the track.
It is 9:30. Upper Des Moines update.
are you good enough to clean up the Trinity Rail? You have another one of these or not?
I'm sorry.
You have another one of these? One for that. Thank you.
Good morning. We're just here to provide an update today as far as how operations have been going. It's been quite a year, obviously with the pandemic and everything and changeover with staff. With me today is TJ Fair. He's our director for these counties in the northern region of Upper Des Moines there. I just wanted to share with you, this report is covering the period between October 1, 2020 and March 31st, 2021. I think we're in July, going in August, but nonetheless covers that period. I did want to share with you the numbers that are in the letter as also we'll cover through some of the pages here, but in these last 6 months in comparison to last year, the number of individuals that we serve has increased by 15%, and the number of households has also increased by 8% in Osceola County alone. As you can see, on the second page, we provide a list of demographics in regards to the people that we serve here in the county. A variety of different demographics are included there for you to look at. We tend to watch these more for data reporting to the federal government, to the state government, if there's a major shift, and then we try to respond appropriately as to if there's a possible need The one that I think provides most information for y'all is the, blue bar one. And that one has a more breakdown. Though the numbers are different, these are duplicated numbers, meaning that there may be an individual and or family member that comes in more than one time during this period that we serve. So if you look at that one, you can see that we served over, maybe in some cases more than once, 422 households and 989 individuals in those households. So the numbers are much different in that capacity. Obviously, one of the biggest services that we provide in here is the emergency energy services, which is our low-income housing energy assistance program, LIHEAP. And that one actually is going to be opening up again here in about a month. So I don't even think we've had a break over this last year. It's been just consistent in the amount of money coming down from the state and federal government with CARES money that's kept that program in operation consistently. So, and I think our staff are looking for a big breath sometimes. It's been quite a haul this last year. Obviously, one of the other programs, and this has been more of a struggle because I think the pandemic has created a lot of confusion, as well as the number of staff that we've had haven't been redirected from their various locations. If they get exposed, they have to be quarantined. All those things have to be obliged. And I don't know if you're all aware, but it's like in Osceola County, but you can't find a person at what we pay for wages or anything. There's a lot of vacancies right now in a variety of jobs. And that was also another one that we struggle with right now throughout our 12-county area. So, another one is obviously the holiday special projects, and we do that one, also back to school, and some of the other ones are also considered into that one. And then our housing programs is increased in Osceola County, which I find interesting. And that one is the Emergency Solutions Grant, we call it, and then also the tenant-based rental assistance that we provide. TBRA is, that one is used for up to a year and can pay for rental subsidy until an individual can get on Section 8. The EST program will pay arrearments in housing if that's an issue with their rent, and then also help come up with utility disconnections and things so that this becomes a profit as well. And then, of course, in our senior program would be our CARES program, we provide that in operation.
One of the things that we did this last year here, and that kind of falls in the special projects, and it's not going to show in these numbers particularly right now, is that we started our birthday room, which we are sending out like little birthday cards for family members of any child under the age of 9, that they can come into the office, get a couple gifts, cake, frosting, candles, plates, napkins, and everything, kind of everything for what you would have for a birthday party. And a lot of counties have been doing it for some time, but not over all 12 counties we have done it, and it is a huge hit. It's very well needed. We have been, and we started really pushing for it, and it wasn't in this county, but I'm sure this has happened in all counties, as we had a couple, some grandparents that came in and were wondering if there was anything we could do to help them with the birthday. And we said, oh yeah, we have a birthday room, and they're like, oh, I wish we would have known that last year. Because last year, the birthday gift was we went and sat by the lake. And that was the gift. And that just kind of made me think, and our agency think, that we needed to do a little bit more to help people out. And I knew that it would be well received. I had no idea it would be this well received. Just here in Osceola County, the first day that she sent the cards out, she had like 4 or 5 telephone calls for appointments for people to come in. So, obviously, we found a need that was very well needed, and we're matching that. So in that area where you're seeing the holiday special projects, that number is going to increase due to the birthday room that we're now providing.
Also at the bottom of that page, I wanted to point out to the cost of the services, and those services that we share with $117,014 and some change there. On the back page, I did a revenues and expenditures sheet for you, and next year, I apologize, the column on the right is for what we did all year last year, and I'm just going to do apples to apples next year and put 6-month comparisons from the previous year along with the current 6 months that we've had, so that way you can compare that. But as you can see then, with the current actual year underneath that column, you can see the revenues above we brought in through either CSBG funds or county funds or donations, $23,770.90. and the expenditures came to $24,892.48, and right now, we're in the arrear of $1,121.58. By the end of the year, then what we'll do is, as we get closer, Upper Des Moines then looks at the balance in each of the counties. Some counties do better than others. We move that CSBG money around to cover any arrearments in the counties that we serve. This is not a request for funding, so we're not doing that. I just wanted to show you what the costs and revenues and expenditures were in this area at this time. Any questions?
What's the total CSBG received by everyone?
Approximately $432,000.
How often is the office open here?
They're open Monday, Wednesday, and Friday,
8 to 4, 8 AM to 4 PM. With an hour
close
session.
But they are open 3 days a week.
Correct.
Do you have somebody come in and sit there, or do you have somebody in the county that sits there?
We have staff, we have one staff member that, runs that office during that time.
Okay, they're from here, or they?
Yep, they're from the instantly.
Okay.
And if there's ever a time that she is ill, the office may be closed, that day, because it's, hard to rearrange it, basically at 8 AM in the morning to get somebody over here. So that does happen every once in a while. When you are a one-man show, that does happen. But when she goes on vacation, I've been the one that has covered the office.
No, when you have your meetings, can we get copies of the minutes?
They're posted.
They're on our website.
Our website.
So you won't. Okay, go get set up.
It wasn't happy to send.
Okay.
You don't send them to everybody, otherwise we'd be spending a lot of money on it, that's what we posted.
You just email them to me, I can forward it to the board, that's no problem, you don't have to mail it, email it, I can forward it. You can forward it.
Because she knows how to get hold of us. What to,
Anything else?
Any other questions?
Nope.
Okay.
Thank you.
Thank you.
Yep, thank you.
Get them, I changed the antibiotic yesterday, because they don't work the infection. It gets out, we're hoping it's pretty good, not, we'll keep them for a while, we'll see.
Your mom, when he comes home, right?
Well, she's probably staying with her myself for a while,
Yeah.
she can't drive. So, if my dad does get back, he'll probably be with us for a few weeks, so.
He won't be able to be by himself.
No, but even if my dad, even my mom did break her wrist, my dad still cannot go home. He's got a strong enough to do it by himself. Last week Monday, they were in the hospital here, and then they transferred him on Wednesday. We knew his kidneys weren't functioning already in March, and we were supposed to have a stroke. The urologist was going to put the names and all his numbers were good, they didn't want to rock the boat, and just wait and see it, and then a second PTI within a couple months time frame, and has a lot of issues. Diabetes and health situation.
My sister has the same thing.
So,
Did it ever get to the point where they could go to Harvard?
yeah, I don't know if they were going to talk them into that. Yeah, they might.
Well,
I
I'm
don't know
just
if they
saying,
can
it's
afford
a
it.
little more, well, than what they for nursing.
They do have nursing home, right? We would have to check into it to see if it's
I don't
safer to
think
do with it.
I don't think it covers, well, I shouldn't say that.
Some do,
I don't
some
know,
don't.
some do, yeah.
My dad only has nursing home for a year, my mom has a little bit longer, so, yeah, we'll see. It's just been a long last few months.
It's a tough deal.
It is.
I'm not gonna say I understand your dad, but that's what my dad was. He never, after my brother was killed, he never, my mom learned to live with it.
Yeah.
That's what my dad never did.
You know, I can see that in my parents, and, you know, I discussed multiple times free counseling, but I get nowhere, and I tried multiple times with home health before this happened, and I got that look, and then I got the silent treatment.
How dare you suggest we can't take care of ourselves?
I said that I won't be stubborn when I'm old.
I just hope not, right?
You will.
I will be. Yeah. We both know it, we're already, but, you know, our kids are nurses, our girls are nurses, pretty much told us.
They probably are stubborn enough bound, right?
Yeah. Well.
Good stuff. I'm not into you.
Right now. I think once my dad could feel better, I think he would have more motivation to do rehab, and he feels terrible. Yeah.
Feeling that way, you don't move much.
Yeah, he went in the chair to eat supper last night, he was just done.
Your appetite about it gone.
Oh, yeah, finally, yeah, he had a smoothie last night for supper, that was it. And then lemon tea. His restrictions on liquids, because they don't have kidney working.
Did you hear anything from the engineer applicant?
Yeah,
That engineer applicant?
that ain't better than what I was last week.
Well, I did get your email that O'Brien County has posted a assistant.
I told Jack, I need if you heard something over the weekend, let me know, and I would add it to the agenda, but I'm not heard from Jack. Unless you emailed me this morning, while you're on the board meeting.
I kind of take that as a no answer.
Maybe you getting married or something.
Next, October.
This year.
October, wasn't it?
This year, yeah.
Thanks for you.
I've not heard anything more from Jack. That emailed me this morning.
Tax abatement.
This is Becky's gone this week, but it's a 20-year tax abatement. And, the person that wants to buy it wants to know if the board would waive some of the abatement. As you can see, the taxes are $1,691, and the penalty and costs are $3,588. Becky recommends canceling her certificate and waiving all the penalty and costs, and then it's up to the board if they want to waive the taxes on it. He wants to know if the board will waive some of the taxes on it before he starts cleaning it up. I guess Ashton days are coming up, and they kind of wanted to clean up before then. He would start, but he just wanted to know what the board consent was for this.
I could see dropping the penalties, but I think the taxes, we can still pay. The $16.91. That's just my idea.
That's where I started too, but a year ago in April, we abated all the taxes in Harris when someone was willing to take over their property. That was 10 years worth, so
And then it's 20.
this is 20 years worth.
How does that work? when somebody doesn't pay the taxes, does the county end up with it right away? Or
If no one
somebody-
like it.
I just had, on the way to town, I had a guy call me in a situation, wanted to know how.
I don't know exactly how it works, but I think if no one buys it at treasurer's office tax sale, and I think the county gets it, you know, it's like a 2-year process before they can, technically the counties or whoever buys the tax sale.
Because the guy said it was the same situation, the guy had to pay the taxes, he won't sell it to him, he wanted to know what the process was.
Yeah.
To,
Do we know, I guess we have to check with the treasurer's office to see if it got tax sales this past year. I mean, last year we didn't have tax sales, so there was nothing, but.
yeah, he did, and I don't know that.
They said it's a county held certificate. If we become the owners, they're still liable for the taxes, they just, it's the way I said it, or looked at it, is they don't really have the right to enjoy the property. But they owe the taxes, and once they're paid.
So if somebody else comes and pays the taxes,
Once the tax sale, they pay the back taxes, like,
Yeah,
and
that's
they're,
what
they
happens
transfer to their
there.
peers.
But then, it's like a 2-year process.
yeah, I know you can't just, they just.
It's another rate to redeem it.
Right, they have
After
that.
you pay for it, the renewal is the rate.
And then they have to pay out the penalty and cost and the taxes and get it up to date. It's like a 2-year process, I
And they pay
believe.
you, interest on your money.
Yeah.
Some time ago, I did a little piece of ground that was a driveway, that somebody else owned it, and next to mine, and he said, I want to pay the back taxes. So, that's all I had to do. But, I don't know if they got their.
But they have up to a year to renege on that, I think.
I thought it was 2 years.
Is it still?
I don't think it's that long.
No, is it that long?
I
Okay.
think it's 6 months or a year.
Okay, well, definitely,
Unless
I
they
told them to come in and talk to you.
Yeah, you know, need to talk to
Yeah.
the treasurer's office.
Yeah.
They can
Okay.
help with that. They're the ones that need that.
So what are you guys thinking on this one?
That was just my thought, I'd like to see them pay the taxes and eliminate the penalties, but whatever you guys think, I'm open.
I'm thinking the same thing.
Thoughts, Jason, you wanna waive the whole thing, or?
I don't know why we would expect someone to pay 20 years worth of taxes when a year ago we gave up 10 years worth of taxes and gave somebody the property.
Would you think about splitting the tax, I don't know how to do that? Waive the penalty and split the
I
taxes?
think they can do whatever you want.
Yeah, that's just a thought, waive the penalty and.
Yeah, if that's what you guys would like.
Well, I just thrown it out there.
Yeah.
Halfway where you're at, Jason.
I can live with that.
I'm fine with that.
Does somebody wanna make a motion one way or the other, or?
Make a motion that we approve the waiving of the penalties and the costs and abate 1/2 of the taxes to have the tax sale certificate assigned to Pete Corson.
We have a motion and support for that. All those in favor?
Aye.
Aye. All those opposed? Motion carried.
That would limit it to him following
Yes.
through. If he doesn't like that, then all of a sudden they're still in place and.
Yep. Okay. Let's see, we have to go back up to certified tax levies.
This is one sheet of the taxes for each taxing district. I think I have to.
Got nothing yet. Thank you.
You get,
Not even struggling.
when you said that, but I didn't look like it.
These consolidated tax labels because of legislation, but the consolidated tax rates are certified by the state. Formality.
So we just have to make a motion to accept it.
Yeah.
Make that motion.
We have a motion and support. Any more discussion?
I'll abstain since I didn't vote to approve the budgets and the rates that were used for this.
All those in favor?
Aye.
Aye. All those opposed? All abstains? Thank you. Motion carried. Discuss Northwest Care Connections, state matches, and Northern Iowa 2080. Is that you, Jason?
Yep, I emailed you the 2080, we're looking at altering, nothing really substantial, but you've got a copy in the packet here too. Primarily it was required because we're changing our name from Northwest Iowa Care Connections to Care Connections of Northern Iowa. Legislation addressed or required a couple other things being addressed. Section 4.3, we're going to eliminate, or we intend to eliminate, the weighted voting with county-funded system. We've taken the approach that the elected officials had 2 votes, and the non-elected participants on the board counted for 1 vote. State funding, I don't think that's the issue that it was, so that'll be struck. The next thing I pointed out was basically the county won't have a Fund 10 anymore, the region itself won't have an ending fund balance in the near future. So eliminating language within the 20 concerning that. And then the last thing primarily is the member county withdrawal or removal. Primarily the effect of that focused on the ending fund balance of the region, and I don't think it's going to be the issue that it used to be when we were kicking the money in. Now the state funds each region based on its population basically, so the dollars will follow the counties to whatever region they're in, and the regions don't really retain, the counties don't really retain those funds anymore.
So, when we get rid of Fund 10, whatever balance we have in there, we have to send to the region, or keep it?
That's still kind of being worked out, I think. I mean, we've got some options to consider there, but that's kind of what I favor, is just each county send it to a regional fund and move forward. The last thing was in prior, the region never really owned property, had assets. We used member counties' facilities or things like that. Move to this nature makes it a little harder for a member county to be incentivized to utilize their assets for the region, because it's more of a state model, I guess. So we included language on methods of acquiring and disposing of property. Those are the main things. If there's anything striking or concerning, just let me know, but I think that's the way the changes will likely occur, and I guess we'll probably go this afternoon at the meeting. Wanted to update it before we took action at the regional level. I don't think action is needed unless you guys have something.
Anybody got any questions for me? No. They put a little work into it. Okay, we'll just keep us informed then. Okay. Discuss Dickinson County Drainage District number 15.
Okay, so I got a call a couple weeks ago from Rick Hopper, and they wanted a shape file for annexation and 15 for local Osceola County shapefile off the GIS. And when I was talking to him, I said, our board is under the understanding that this isn't gonna happen, that our drainage attorney said that it wasn't, the board does not have to proceed. Well, their drainage attorney has a different opinion than our drainage attorney. So, when I was talking to Ivan on that, he suggests that we formally send a letter to Dickinson County to let them know that Osceola County is not in favor of the annexation of DD number 15, and I think the lawyers are gonna have to discuss it, I don't know.
We authorize, I mean, would that be authorizing ISG, would really have retaining for this district?
No,
Or our attorney?
our attorney just sent a letter.
A letter. In line with this recommendation, this request.
Right. I don't know if you want our drainage attorney, or our county attorney, or.
I understand what their attorney was saying, I think the code can be applied to the situation. I think it's a stretch as to proving that it's really fitting.
That's their drainage attorney. That's my thought.
I don't know how you get a third opinion, because there's only two drainage attorneys in the state. And they use one and we use one.
But my intention is to dig my heels in and not proceed with the annexation, and ultimately, the residents of 15 need to realize that if they proceed with this, and it gets drawn out in court, they're paying all the costs out of that drainage district to accomplish it, so it's only gonna cost them. I don't know if the benefit is worth it, but I don't know, my attorney can include that language, or, but I'd be glad to talk to our attorney in requesting this letter being sent, and if he feels that's a benefit to include, is that all right?
Yep.
Yeah, I agree. Pay for that?
Yep. Formal for that or not?
I don't, because if you want to, we just kind of discuss it, so I guess we put in our minutes that,
It should be in the minutes, I'd say.
and I will, so we would have it as a motion, and we can formalize it then.
Yeah, like most have Jason talks to our drainage attorney.
Send a letter of opposition.
Yeah.
Certainly, District 15 issue.
We have a motion, is there a second?
I'll support that.
We have a motion and a second, all those in favor?
Aye.
Aye.
Those opposed? Motion carried. Let's see, let's skip over one.
No, we just got a place on file the preliminary part, we just, board doesn't need to make any motions or anything, we'll do that all on the 10th, but letters are being sent out, so we just wanted to place on file. So I just have to make,
We'll reflect that the
yeah.
decision will be about.
Yes, I just had to make a motion in our minutes that it was placed on file, our board.
Is that a motion, Mike?
You don't really need to.
Don't need a motion?
No, don't need a motion, you just need the,
Okay.
that's on file.
Okay.
All right, no more discussion on that?
Or you would have a separate board meeting.
All right, I guess that's, claims.
We have a claim 142 and 147 at the bottom of the water service.
I'll support that. All those in favor?
Aye.
All those opposed? Abstained? Abstained. Motion carried.
keep out there, and put in another 93,000.
Yep, real estate estimate, so the windows are supposed to be coming in this week.
You mean, is that coming in, put in, or?
They're coming in to him, and the plan is next week to start, doing the
And
windows.
they're gonna start on the upper level? or-
That's their goal, but of course, in August, the court's kind of busy, so they're gonna have to work around the court system, but, they've been very accommodating so far, so.
Now, they have 3 windows put in, is that what?
They have 3 already done upstairs, yep, and they wanted those mock ones to make sure that we get any new seals and any of that stuff. He's ordering the brick, get that going.
How much have we paid them so far?
$103,000 we paid the last time, and then we paid them,
Close to 200.
yeah, and then we paid them another $20,000, I think, back for the attorney's office. No, I gotta make sure I have as many budgeted for them, because that's just in right away, but we're good for a while, until I don't have to give another, good budget amendment, so.
Make most of this, claims.
Motion is to approve the rest, the rest of the claims. All those in favor? Opposed? Carried. Any other updates or anything, anybody?
We had a meeting the other day, last week, with right beginning, and they want to stop this losing money every year, so they're gonna go around trying to get help. So I don't know if Ben is gonna be coming up or whatever. It's say about $77,000 last year. Yeah, well, they've been losing money ever since they started. Yeah. They have never made any, and they want, well, you probably heard, they raised the rates, and that raised the other stuff too.
Who makes those decisions?
Most of the board. That's all under their.
Yeah, I understand. They're really making it a tough one.
Yeah.
They're gonna lose some business.
Right, they're gonna lose
Just
a lot. They're a lot.
Simply can't afford it.
Right, and I understand that, but you can't be losing money either. Not that much. Well, they might have to come halfway or something.
That's what I would like to see, if we could convey that. I mean, they raise the rates and
Yeah, they should have done that a long time ago.
well, they said the rates, but then you can't, it's 40 hours, there's no negotiating on it. If you wanna take one day a week off and, understand, it's still have to help. I'm gonna say it's killing something, so it helps.
And it's hard to keep the staff, if you're gonna have people, 2 days a week, 3 days a week, hard to keep.
I could separate that from hospital, so they aren't given all the hospital benefits.
Yeah, but then you're gonna have trouble with the health.
That's the way to go.
I know, but, this is kind of a touchy deal.
Oh, it is.
It's, they're paying benefits even to the part-timers.
Yeah.
But at a lower rate, they gotta pay more.
But even at that, they're gonna have to separate it from the hospital.
That's an expensive.
They can't get workers, then they're not being able to keep
Right.
open for people either.
All men do. And if they raise the rates, they're probably gonna lose
They're
them.
gonna lose there
So
too.
then they're gonna,
There's a waiting list, isn't there?
then they're back.
Isn't there a waiting list?
Yeah, there is.
There is, but not the rates they got now.
Yeah, waiting list might be gone. But then we're also gonna have a meeting to see if they can get more in-home care.
In the city, they had somebody come to town that wanted to start a daycare, and the city wouldn't change their zone.
And see, that's something they're gonna try to change if they can. So,
I'll admit I didn't hardly get to any of those, meetings on child care studies, but, and just like we got this housing study, they want us to be a part of it. But the
Ben last week, to see if we talked to them and pay for part of that study. And I'm gonna meet with Jamie at the school, see if I can talk him into paying for part of it. Because we all know we need it.
Yeah. But what are those, can you tell me, Nick, or Jason, maybe you know, what do they actually cover then?
I don't know.
Is it just, do we need housing, or do they study how we're gonna pay for it?
I don't know what they all cover. I don't think I've ever looked at one before.
We're gonna have to figure out how to pay for it.
Yeah.
You can always, like you said, you can always, do a study on how many people need houses. What to do about it, you know?
And I met with Ben too about the EMS. And, I would like to see a way to get some of the nurses, to get them to go. And he was gonna talk to him again. Last time around, he says, I got shot down right away.
This is off the subject again, a little bit back to housing, but, co-op elevator in Sioux Center has started working with the city and the county, and to build spec homes at cost, you know, if the city would go ahead and, either it's up in the city or the county, or, you know, I don't know how you fund that either. It's just a pilot program, and they're building one home now, and hopefully build 3 next year. And we're doing it as kind of a partnership to help the city and help, because the elevator has struggled with employees finding work lots. Something to think about. And the other thing is, I don't know if you guys read your county conservation minutes. They did, put in an offer to buy some additional land at Willow Creek. I think it's 31 acres, I believe. And, it was appraised at 10.6 or something. They offered $1,000 less than the last I had heard that they accepted, so. That's good, so.
You know who they buying that from? To the south or?
To the south, yes. I'm actually trying to develop more camping stuff. Didn't know if you guys read your minutes or not.
Usually, we've been home.
Yeah. I actually missed that meeting as I prepared it. Nick and I, talked pretty regularly, but I both sessions. Do we? Do we need that?
No, I guess I would have hoped they would have used closed session for that. They only negotiate up to an amount, doesn't really give you much power in negotiating. But
I missed the meeting, so I'm not sure how they handled it. Yeah. That's all I have. Anybody else got anything?
We need to talk about that. OCIO.
OCIO, via the OCIO program.
Okay.
I just don't think we need to take formal action, but I'd like the minutes just to reflect that we encourage the department heads or, you know, to give consideration and participate in this if and where deemed appropriate. I had a thought of providing or using this to provide laptops or some sort of device for board members, but $9,500 is chewed up in a hurry. Trying to provide 5 items, so Rochelle said maybe a laptop designated or used primarily for board secretary, or in fact, we run through your office and Phil says that you're the secretary of the board. But, no, I mean, just so the minutes reflect that, and if you encourage departments to look for ways to do this, wait till our next meeting, the application period is almost over, so.
Would iPads for the board members be something to think about?
We really have done that.
We do that for, our elevator board, and believe it or not, I use it quite a lot. For me, it seems very helpful, you know, I can keep track of things a just something to think about, I think, basically, if we can use it,
Yeah,
if we can get it, we should
go for it.
I think they talk about iPad, but it's more,
it says laptops and accessories, and I don't know what that means.
they're having a webinar or something on it. I was gonna give
That's
it
gonna
out
be-
to you.
You're pretty quick, that webinar starts like 20 minutes, I thought already.
Yeah, this week. It'll be Thursday.
Yeah.
Friday,
Yeah, so I was gonna watch one of those to see what all involved with it.
Are you gonna inform the rest of us?
I'll try my best.
Thank you. Yeah, I would go along with that. Encourage that.
Would that be something else for you, a laptop or something?
Yeah. I don't know if I can type as fast as Amy does to write out motions. This is
You'll
a
have
work
to
in
still scratch
progress.
it down and
Yeah.
then go back to your office.
Yeah. So,
Here's that, Jimmy, for your minutes.
yeah, this is, these are very curious department heads. Once I get more information, I'll share it with the department heads and then see where the need is at and go from there. I'm still working on FEMA, so it seems like it's been a long, drawn out process. In Rice Grant, I need more information, so. Just want to get something crossed off my checklist. I can't get it done.
Mike, do you know what that housing study is gonna cost?
It was like $20,000 or $25,000.
You can find out, and I can get it too.
Because the city paid $5,000, and they have a matching $10,000 grant.
Oh,
So it cost them $5,000 for sure. And I don't know, after the $15,000, I don't know. Is that what Stephanie said?
Something like that, 20 or 25,000.
He said some, yeah, something.
Yeah.
If it's private companies, yeah. If it's through private
Yeah,
companies,
if
it
it
was
was
that.
through them, then it could be the.
If it was through the ISU, it was like the five.
Didn't they cover it? Yeah, ISU housing study, covered by the 5,000 and the
Right.
5,000 grant.
Right, that's how I took it.
We'll have to come up with that.
Steph indicated that she didn't know how it compared quality-wise to some of the private ones, the more robust housing studies, but
But in the council, then the city has to ask you all the acting members or each city did it or city people or whoever, now have to be active members.
I highly doubt that no chief Harris, that's my way around it.
Just let me know what they need and know what we need or what they want or how they want to proceed.
do we need to, Sandy, when she was, discussing us, do we just discuss that again next meeting, or?
I think it'd be good.
Talk about that anymore, or?
My reading of it is at this point, I wonder if we can't make the designation and then call for the election when we deem appropriate. I don't read it to say that as soon as you have a resolution that you have to have an election. The language kind of leaves it open that we distinguish it as an emergency or essential service. And when we want to use one of the fundings that are allowed by it, it has to go through a vote. I don't think just saying we need this funding source and putting it to a vote is a good idea. I think it's going to be an uphill climb if you're not very well prepared and well stated. And if it goes down once, I think it's higher likelihood it could go down the next time too.
Yeah,
So
we need an advisory board and we need to educate and promote it.
at this point, I would favor, and I'll talk to the attorney on this, but doing the resolution stating as a board, we determine this to be an essential service. The next step to follow when that is needed.
Like, if we need, my opinion is we need to know what it would cost, wouldn't we?
I think we should.
Or have a plan or something to,
Well, we're gonna fund with
we're
that.
gonna fund with it.
But for just hiring people, or just, I mean, it's it's a maximum period of 15 years, and it has to be voted on again. And within that 15 years, you can receive a petition to discontinue it. So year 3, you might get a group of people that, the heck with this, and then it's gone. So it's not something we can just say, let's do this and count on it forever. We need to.
Because, you know, we have a fall election this November, but I think that's not a thing we need to thresh out next year, because that's too soon to get people educated and promoted and to know what we all need, so.
The voter approved local option income surtax has always been in the law, and we've never done it. So now that it adds a second potential funding, I don't think we need to run just because there, we didn't do it before. We need to be careful when we don't do it.
And there's a lot of counties that, you know, they wanna do it, but there's not a lot of information out there, so we need to.
No.
It just, and it's affecting a lot of counties, we're still trying to muddle through all this to figure
I
out.
would say they should just start paying people. I really personally struggle with if we'll have them, whether we pay it or not. People just do not want to do it.
And we will, but the price is going to be pretty darn high.
Well, yeah, if you get up there where it's like a full-time job, but
And
it's not a full-time job. To me, anyway, and I've been on there, so, but.
Well, not for the paper, hopefully, but the individual she cited that's taken a sick test, and if it doesn't go, has to go back through it. I would rather know that, because this is important stuff they're going out to do. I know the doctor that graduates last in his class is still called doctor, but, I want a good quality team that's on the spot as well, not just.
And before we hire full-time, we have to get the hospital on board, because then we've got working between the two. And I think Ben would be willing to get on board with that.
The examples Dan gave us of surrounding us, we're county funded, were they? I'm not sure about Lorraine County, was that what you said?
It's hospital.
It's Livingston Hospital, Dickinson Hospital, that's
Sheldon Hospital.
what we're talking here. Those are different, whole different.
That's why, because Ben and I touched on that just a little bit the other day. And he said, then we have to sit down and talk about it, working between the hospital and.
Oh, add it to the agenda.
Because he realizes as much as anybody that we need the ambulance. And it's for them, basically. Well, and for.
We're all driving in that kind of deal.
One of the services that we have.
His comment was, we've got one money pit now, we don't need two. Jerry listens, I don't know.
Yep, those three.
Anything else?
In preparation, it talks about if we do this resolution, we shall coordinate efforts with the local emergency medical service station to establish a county emergency medical services system advisory council. Cindy, may provide some names or start talking to some individuals and see if there's even interest or willingness to participate in that.
I don't almost think one of them should be Dr. Rachel.
Be nice if we could have one from each town, would be nice. It would affect all of us. The whole county. If we could get one from each town. And if we can, that would be my thoughts on that.
I would make a motion.
That's what you're.
Yep.
Motion is made, seconded, all those